In this video, you will learn about hypothyroidism for nursing. At the end, take a short quiz to test your knowledge and critical thinking skills. This video will prepare you to pass nursing exams. Now, let's begin. What is hypothyroidism? Hypothyroidism is an endocrine condition characterized by an insufficient amount of thyroid hormone due to the thyroid gland's inability to produce optimal thyroid hormone levels. Important to know, this disease occurs most frequently in women ages 30 to 60. Now let's go over the causes. Hypothyroidism has various causes, including the following. Thyroiditis. Inflammation of the thyroid gland may occur due to a viral infection or an autoimmune attack. Congenital hypothyroidism. Hypothyroidism has been present since birth due to the absence of a thyroid gland or a dysfunctional thyroid gland. Medications. Hypothyroidism may be caused by the use of various medications, such as lithium, used to treat psychotic disorders. Certain medications used for cancer, such as thalidomide, or medicines for treating heart conditions, such as amiodarone, may also cause hypothyroidism. Autonomic diseases. An autoimmune disorder, such as Hashimoto's disease, is the most common cause of hypothyroidism. In this disease, the immune system, which functions to fight against harmful substances, attacks the thyroid gland by considering it as a foreign body. Previous thyroid treatment. If the patient has undergone the treatment of the thyroid gland previously, such as surgery or radioactive treatment, hypothyroidism may occur as a side effect or complication of the treatment. Iodine deficiency. Iodine is a needed production of the thyroid hormone. Insufficient amounts of iodine can cause a decrease in thyroid hormone, resulting in hypothyroidism. Since iodine is not produced in the body, it needs to be consumed through diet. Pituitary disorder. The failure of the pituitary gland to produce thyroid-stimulating hormone, which interferes with the release of thyroid hormones in the bloodstream. Now, let's go over the clinical manifestations. The signs and symptoms of hypothyroidism may not appear immediately but develop slowly and gradually over time. The signs of hypothyroidism include the following. Weight gain. Fatigue. Elevated blood cholesterol levels. Forgetfulness. Heavier or irregular menstrual cycles. Constipation. Dry skin. Puffy face. Now, let's cover the diagnostic findings. It is difficult to diagnose hypothyroidism based on just the signs and symptoms, and the manifestations of hypothyroidism may also be seen in other conditions. To confirm the diagnosis, the healthcare provider may perform physical tests or recommend some blood tests. Healthcare providers may perform a series of assessments and tests that include past medical history, physical test, thyroid function test, imaging tests, and thyroid antibody test. Let's start with the physical test. The healthcare provider will perform a physical exam by palpating the thyroid to see whether it's swollen. Thyroid function test. This test is performed to check the levels of thyroid-stimulating hormone and thyroxine, T4, in the blood. The diagnostic findings of this test show decreased levels of T4. Sometimes elevated TSH levels and normal T4 levels may be found, which indicates subclinical or mild hypothyroidism. In some cases, levels of T3 may also be measured. Imaging tests. Sometimes healthcare providers may also prescribe imaging tests such as an ultrasound to look closely for the thyroid nodules, a thyroid scan to clearly see the size, shape, or position of the thyroid gland, and the radioactive iodine uptake test to reach the main cause behind hypothyroidism. Thyroid antibody test. If an autoimmune condition is suspected, the provider may recommend a thyroid antibody test that rules out autoimmune conditions that may cause hypothyroidism, such as Hashimoto's disease. Medications for treatment. The most commonly prescribed medication for hypothyroidism is levothyroxine, taken through the oral route. This medication is a synthetic form of thyroid hormone T4 that is identical and resembles the action of thyroid hormone formed naturally by the gland. Levothyroxine returns the levels of thyroid hormone to its normal range in the blood. When the level of thyroid hormone returns to optimum levels, the symptom of hypothyroidism alleviates. All the patients with hypothyroidism can be given levothyroxine and treated as outpatients, except the patients with myxedema. Taking the correct dosage of medication is important since too much or too little dosage can have side effects. High dosage may cause an increase in appetite, palpitations, or insomnia. Taking too little dosage of medication wouldn't show changes in the condition, and hypothyroidism will continue. Mostly, people with hypothyroidism remain dependent on the medication for their entire lives. Care plan. The care plan for hypothyroidism constitutes a structured approach towards the comprehensive care and management of hypothyroidism. The care plan keeps the nurses and other healthcare providers well informed regarding the patient's condition since all the information is kept in one place and includes details like assessment, nursing diagnosis, interventions, goals or expected outcomes. Assessment. The assessment is to analyze symptoms like fatigue, palpitations, weakness, cold intolerance, constipation, and physical signs such as weight gain, dry skin, hair loss, hoarseness in the voice, trouble focusing, etc. Nursing diagnosis. Nursing diagnosis will include the following: lack of energy and decreased activity level due to fatigue caused by impaired or reduced rate of metabolism. Imbalanced nutrition leads to weight gain and constipation. Lack of knowledge regarding hypothyroidism interpreted by questions raised by the patients and their attendants regarding the medications and lifestyle changes. Decreased cardiac output caused by bradycardia and reduced cardiac contractility. Imbalanced body temperature and cold intolerance. Interventions. Nursing interventions will include the following: fatigue. Advise patients to rest in intervals to avoid overexertion but also motivate them to perform activities when energy levels seem to be sufficient after taking medications. Educate patient on balanced diet. To maintain weight and manage gastrointestinal symptoms like constipation, educate the patient on taking a balanced and high-nutrient diet and high fiber and increase their fluid intake to ease bowel movements. Maintain body temperature. Regularly monitor the body temperature of the patient and provide them with an extra layer of clothing or covering. Manage the risk of decreased cardiac output. Regular monitoring of heart rate and blood pressure to prevent the risk of complications. If a patient experiences shortness of breath and restlessness, elevate the head of the patient's bed to reduce the cardiac workload. Goals or expected outcomes are the following: TSH levels return to the desired levels. Decreased symptoms. The ability of the patient to live a normal life and carry out daily activities. Increase in energy levels. Evaluation. As a nurse, you will want to evaluate the patient on the following: laboratory results. Evaluation of the laboratory results showing the thyroid hormone levels. Activity level. Ability to do activities of daily living and self-care. Resolution of symptoms. Evaluation of the symptoms being increased or decreased, and if not being reduced, report to other healthcare providers for further evaluation of treatment. Patient adherence to treatment. Evaluation of the patient's adherence to medication or other methods of hormone replacement therapy. Cardiovascular condition. Evaluation of the daily records of cardiac values, such as heart rate and blood pressure, to assess the cardiac condition and whether cardiac symptoms are being managed. Bowel movements. Check the diet chart and bowel movements of the patient to see if the constipation has resolved. Well, this ends this lesson on hypothyroidism. Click the link in the description below for a free interactive quiz. Thanks for watching.